Welcome to today's special WPQC presentation, which also marks the culmination of our celebration of the first 10 years of the Wisconsin Pharmacy Quality Collaborative's work. My name is Carrie Trapskin, and I've been on staff with the Pharmacy Society of Wisconsin for the full 10 years of WPQC, which began in March of 2008 when the first two WPQC payers went live with the program. We have so many things to share with you regarding the good work that's going on in the state today in relation to the WPQC program. But instead of providing graphs and survey results, we decided to let the patients, pharmacists, community health workers, physicians, and agency partners convey to you the story of WPQC. We have no disclosures to make, and these are our learning objectives. We have developed this presentation around 6 themes that highlight how WPQC pharmacists are serving the underserved: community clinical linkages, targeted patient care, team-based care, public and population health, transitions of care, and continuity of care. We will briefly introduce each one of these themes, which will then be followed by a short video montage describing the work. Before we get started, I'd like to introduce the individuals who will be presenting each of the sections. First, Colin Pearson, who is a PSW executive intern who is in his 3rd year at the University of Wisconsin School of Pharmacy. Next, Jen Fody, who's a pharmacist and comprehensive medication review provider at Aurora St. Luke's Medical Center. Next, Emily Yeager, who is also a PSW executive intern and in her 2nd year at the University of Wisconsin School of Pharmacy. And last, Kinsey Clark, who's in her 4th year as a UW School of Pharmacy student who was on rotation with the Pharmacy Society of Wisconsin. And as you may have heard, we are challenging all WPQC pharmacies to join the WPQC CMR Challenge this year, to do just one more comprehensive medication review than last year. If we do that, we will reach our goal of surpassing 10,000 comprehensive medication reviews to have been provided for Medicaid members by 2019. We hope that you are inspired by the montage that we've put together for you. And without further ado, community clinical linkages.
This webinar is a portion of the Wisconsin Pharmacy Quality Collaborative 2018 annual meeting presentation entitled Serving the Underserved, Celebrating 10 Years of Making a Difference with WPQC. Pharmacists across the state have found unique ways to incorporate the WPQC standards into their practices. This first video illustrates how a patient advocacy group, Unite MKE, empowers community health workers to connect with underserved patients in the Milwaukee area through a program entitled the Hub Model. Unite MKE serves as a hub for the Milwaukee area. Community health workers use integrated software to uncover patients' social determinants to identify and address barriers. Once a patient is identified, community health workers set up meetings at a patient's home. Following the home visit, the community health workers streamline the communication between the healthcare providers and the patient. This streamlined communication results in better health outcomes and decreased healthcare burden. Hyatt Pharmacy, located in Milwaukee, is one example of this work in action. Hyatt receives patient referrals from the community health workers to address medication adherence concerns. This video will also show pharmacists from Hyatt conducting comprehensive medication reviews for the Burmese refugee population in their homes. Please watch and see how Unite MKE and Hyatt Pharmacy utilize the WPQC standards to advance our profession.
Serves as an advocacy for the folks who are being served, the folks who are serving, and to be able to take the work that they're doing on the ground and in the homes and turn it into policy. It's overwhelming. The doctor is overwhelming. The insurance companies, everything about systems is overwhelming to people that are just trying to live. So when someone shows up to your door and they look like you, their demeanor is kind of like very relaxed. I'm here to help. It makes it easier to open up and say, you know what? Yeah, let me just share with you all of my business and let you work that out for me. Right? So if you don't have a community health worker that's not only in the ground but talking back and forth to the provider to say, hey, I'm in the home of your patients and this is what I'm seeing, this is what they're experiencing, how can we help here, you at the clinic, so that this person can get what they need? And so the software allows us to work with the family, take that information, communicate it back to the provider, and then close that loophole of what needs to happen for that patient. Our pharmacists with Hyatt, one of the problems that we had identified was that folks can't get to their prescriptions in some cases. Schedule, transportation, whatever. So being able to have a pharmacist that can help mitigate those barriers as it relates to getting prescription, whether it's having it delivered, personally delivered, or mailed, or creating some type of coordination with the community health worker and the clinic so that that person can manage their medication appropriately, were just great pieces to just anchor this project down for us.
What I like about WPQC is that it's giving us the opportunity to advance with our profession, to do things that we're meant to do after we finish school. So you're not just at the pharmacy checking prescriptions, making sure that this is what they're supposed to get, but you're actually helping the patient, actually making a difference in their lives, taking care of them and their loved ones. And it's up to you to use the platform if you want to actually do better with your profession.
Notice and observe these patients at their home, to really realize that how important it is for you to sit down and talk to them in their home, in their comfort zone, where they're open to you, they're willing and they're listening. They're not worried about grabbing their ride when they're done at the clinic, because when you see them at the clinic, they are rushed up. If they miss their ride, they're going to be stuck in the clinic for another couple hours. Whereas when you're seeing them at their home, they're relaxed, they have their full attention, they're focusing, and you can make a more deeper impact on how they understand their medications.
And for the Burmese patient population, that's a very unique population, and the way I call it is always, no matter as a Burmese patient or regular patient we always try to provide a package from Hyatt. Mostly what we do is just teach them how the system works. They come from another country, they speak another language, and they have no idea. They've been living with their condition for half their life, and now they're being diagnosed with something. They've been living their conditions, their high sugar, their high blood pressure, their headache, as a norm. So we have to teach them what is right, what is wrong, and where to find those helps, where to find the doctor, where to get the prescription, how the system works.
It was a great way where the pharmacists could learn and get certified and be able to offer medication reviews or CMRs to the patients in Wisconsin, especially being in Milwaukee, where we work primarily with a lot of medicated patients, and typically it's 10 to 15 medications on a patient profile. It's nearly impossible to do a consult when they're in the pharmacy. So that has opened the opportunity for community pharmacists to work more closely with their patients and yet be recognized for their time and value their time. PSW has helped connect the pharmacists across the state together and be able to learn from each other's practices, because that's the way to go, where we want to learn and we want to see how other pharmacies are working and kind of work together and grow together. So.
We've entitled this section of the presentation, Targeted Patient Care. In this video, you will hear from a basketball pharmacy patient and caregiver about her experiences with medication synchronization and medication packaging, and how these have helped her better manage her family's medications. Michelle Farrell, owner of Basketball Pharmacy, also discusses why and how they provide these services. Next, you will hear from Andrea Wood at Good Value Pharmacy in Kenosha about her experience this spring and summer participating in a short proof of concept pilot with WEA Trust, a statewide insurance plan. Through the Wisconsin Division of Public Health, WPQC was provided a grant from the Association of State and Territorial Health Officials, or ASTO, to coordinate the provision of hypertension-focused comprehensive medication reviews with a health plan. We partnered with WEA Trust and 6 WPQC pharmacies to provide comprehensive medication reviews to WEA members on medication to treat hypertension. The pharmacies that participated in this pilot clustered in Kenosha and Sauk counties. At least one pharmacist from each pharmacy participated in a training webinar focused on logistics as well as available hypertension-specific and adherence-specific resources. Unique to this pilot was the use of a multifaceted marketing approach that involved both WEA and pharmacy outreach to patients, along with incentives for both pharmacies and patients. The response rate was fantastic. 59% of the eligible patients agreed to the visit, and 100% of those 36 patients completed both visits. The pre-post survey demonstrated that between the first and second visits, patients increased their use of the blood pressure monitor and tracking log at home. The last service highlighted in this section is the Tobacco Cessation Collaborative Practice Agreement that Basketball Pharmacy has with Gunderson. It covers not only nicotine replacement, but also bupropion and varenicline. You'll hear how one collaborating physician regards the services provided at the pharmacy.
My husband takes quite a few medications, and then I take about half of what he takes. So what they do is, it may take several months, but they try to get all of your medications synced at the same time, so they come due and they get filled at the same time, so you're not making multiple trips into the pharmacy, which is nice because it's 10 miles round trip for us to come into the pharmacy.
In doing that, we don't wait till that day they need to pick up. We try to do it preemptively, so like 5 to 7 days early, which really allows the pharmacist to review a profile and then maybe ask a technician to schedule an MTM appointment or immunizations if they're qualifying or in need of those types of services. So it gives us a chance to really do a profile review. So with the MedSync program, we're able to detect when patients are not taking their medications as prescribed. We're able to intervene with the providers to say, maybe this is a patient you want to refer to our medication packaging program. And that's worked really well for us as a kind of a natural progression through life in our pharmacy. So
Michelle told me about this MedPack program, and I was so thankful about that because I have a hard time keeping track of all my medication, and there is no way that I could keep track of all of hers. I do try to go to all of her appointments with her, but with having the MedPacks, it's taken a lot of pressure off of me as her caregiver.
So after we met and really discussed what the goal of this program was, to make sure that they understood how to take their blood pressure and what that meant. And for some patients, we really took it a step further. If they had diabetes, let's tie that into your blood sugar. We're taking your blood pressure, let's take your blood sugars. You're supposed to be doing it anyways. And it's a lot easier to change some activities in your day, your diet and exercise, if you're seeing that what you're doing is making a difference.
I thought it was really in-depth, really nice. She had a lot of great suggestions for me. I went home the first time with a list of goals for myself with a beautiful blood pressure machine. I was floored when she said, I'll contact your doctor and we'll get her, see if how she feels about increasing this medication. I mean, I've never, other than calling a prescription in or whatever, I've never known that pharmacists necessarily can communicate with your doctor.
So the response was incredible. I think even the patients who understood what their blood pressure should be and already led a healthy lifestyle, they loved the idea of not guessing that it's good and actually taking it every day and seeing that it's good. It does really make a difference to have them here in person. Surely to give them the blood pressure meter and first of all make sure they know how to use it.
Right now, but I would definitely recommend other people to it. I was pleasantly surprised. I basically came in and thought I was going to be here 20 minutes and she was going to look at my meds and say, okay, everything's good. It was far more than that.
Within the practice, we've got a few different collaborative practice agreements, and our impetus on establishing those agreements is to take better care of our patients and really highlight the need for good medication management.
And sometimes people actually walk into the pharmacy, which I didn't even realize that was happening until Michelle brought it to our attention. That sometimes patients walk in and are just like, I want to quit smoking, help, what can I get, what can I use? And so we realized that there's kind of a disconnect between where patients were trying to get the things that they needed to help quit smoking and the fact that it wasn't always in our office with us, but often was much more spontaneous.
I can't tell you how many times over the last 18 years I've heard, well, I wasn't really thinking about it when I talked to the doctor, but now that I'm at the pharmacy and you're saying the same thing, I think I'd like to talk about it. And I've always had to say, well, I have to get a prescription for you to get it through your insurance. And now having some of those providers giving us the ability to make the recommendation for the patients and actually fill the prescriptions has been really beneficial.
Patient was in there. Like, I've never had a pharmacy before call me and say, by the way, so-and-so is in, and they didn't look really good. Can you reach out to them? I've never had that experience before. And so I like to think that we have a really good collaborative relationship that kind of goes both directions. I can recommend some of the services that are available for, say, my patients who can't take their medications well. They can get them med packed there. Like, I can make those recommendations, and they can also send some recommendations back my way. I saw so-and-so, or hey, by the way, while so-and-so is in, we talked about this or that. And so it's been really, really good. They do way more counseling than I have ever seen a pharmacy do, and so they can really be an extension, I guess, of our clinic as people are picking up medications for their different medical problems.
This webinar is a portion of the Wisconsin Pharmacy Quality Collaborative 2018 annual meeting presentation entitled Serving the Underserved, Celebrating 10 Years of Making a Difference with WPQC. Jen Fody, a clinical pharmacist from Aurora, will present some of her impactful work she and her team are involved in. Jen began her pharmacy journey by attending Concordia School of Pharmacy and continued by completing a PGY1 residency at Aurora Healthcare Metro. Her passion for teaching in a team environment allow her to excel as a WPQC certified pharmacist at Aurora. Please listen and hear how Jen utilizes WPQC in her pharmacy practice.
Hi, my name is Jennifer Fody. I'm a clinical pharmacist within Aurora Healthcare. Currently, I split my time between working with patients in the medication management clinic at Aurora Sinai Medical Center and staffing in the outpatient pharmacy at Aurora St. Luke's Medical Center in Milwaukee. Through this presentation, I plan to focus my attention on integrating WPQC into the ambulatory care clinic setting of the medication management clinic at Aurora Sinai Medical Center. I have nothing to disclose in regards to the content included within this presentation. Through my portion of this presentation, I plan to cover the services provided within the medication management clinic, explain the proportion of WPQC patients that are seen in clinic, outline our WPQC clinic workflow, highlight disease state outcomes from WPQC services, share some WPQC patient testimonials, and then finally I'll discuss some positive opportunities that have really helped make WPQC successful within the medication management clinic. The pharmacist-led medication management clinic is a part of the Family Care Center and internal medicine clinics at Aurora Sinai Medical Center. A collaborative practice agreement is in place within these clinics to allow our providers to refer patients to our clinics to assist in the medication management for patients with type 1 or 2 diabetes, hypertension, dyslipidemia, heart failure, and tobacco use. Providers also have the ability to send referrals for a wide array of different comprehensive medication reviews, either the general all-inclusive medication reviews or disease-specific medication reviews. This chart demonstrates the breakdown of patients seen for disease state-focused comprehensive medication reviews and general comprehensive medication reviews within the medication management clinic over the last year. As you can see from the chart, 23 out of 90, or approximately 25% of patients that are seen in the medication management clinic are WPQC patients. As you can see towards the top, in the top row, most of our referrals do come for our diabetes-focused medication management and comprehensive medication reviews. This chart demonstrates the breakdown of patients that have graduated from the medication management clinic and have reached their clinic goals as set by the referring provider within the last year. As you can see, approximately 35% of patients that graduated from their medication management program within the last year were WPQC patients. This slide outlines the general clinic workflow for all the patients that are seen within the medication management clinic. All patients that are referred to the medication management clinic through a referral sent through the electronic medical record from their provider. During clinic appointments, we focus our attention on medication and lifestyle changes, evaluation of laboratory parameters, along with any necessary pieces of education. A progress note is documented for each patient encounter, which then requires a co-signature from the referring provider as a means to keep the provider within the patient's care. Any follow-up appointments and duration to follow-up appointments are generally patient-specific. Now, there are some slight differences in clinic workflow between patients with WPQC and those with commercial insurance. For our WPQC patients, DAPO authorization must be obtained for the pharmacist to meet with those patients. The clinic pharmacist then provides the referring provider recommendations if therapy adjustments are necessary, and the referring provider is then the one to make those necessary therapy adjustments. The WPQC patient encounters are billed through the Forward Health portal, and these patients are really only limited to meet with a pharmacist 4 times in 1 year. Now, for our patients with commercial insurance, authorization is obtained through prescriber referral within the scope of the clinic collaborative practice agreement. If therapy adjustments are necessary, the clinical pharmacist is able to make those adjustments within the scope of the collaborative practice agreement. Commercial insurance encounters are billed through hospital coding within the electronic medical record. And then finally, most patients with commercial insurance have an unlimited number of appointments where they're able to meet with the clinical pharmacist. Within the last year, we made over 600 pharmacotherapy recommendations within clinic. This pie chart demonstrates those interventions, and as you can see, over 60% of interventions made involve medication therapy adjustments, whether it's dose changes, medication additions, medication deletions. This chart demonstrates the type of interventions that we made within the last year within the medication management clinic, including provider acceptance rates in the far right-hand corner of the far right-hand column of this chart. Within the last year, 98% of medication therapy recommendations made were accepted by our clinic providers. The next few slides outline average disease state outcomes of patients seen in the medication management clinic within the last year. I'm going to focus on the outcomes made with our WPQC patient population, which is outlined in the bars located on the left side of the graphs. The bars on the right side of the graph indicate average disease state outcomes for all patients that were seen in the clinic within the last year. The green bars represent average baseline data, and the blue bars represent our year-end average data for those patients. For patients with diabetes, as you can see in this chart, the average baseline A1C for our WPQC patients was 10.9% in comparison to the year-end average of 8.3%, showing an average 2.6% reduction in A1C for our WPQC patients. For patients with hypertension, the baseline average blood pressure for WPQC patients was 186/98 millimeters of mercury in comparison to the year-end average of 134/80 millimeters of mercury, showing an average blood pressure reduction of 52/18 millimeters of mercury for our WPQC patients in the last year. For patients with dyslipidemia, the baseline average LDL for WPQC patients was 141 milligrams per deciliter in comparison to the year-end average of 82 milligrams per deciliter, showing an average LDL reduction of 59 milligrams per deciliter for WPQC patients. And then for patients with tobacco use, the baseline average number of cigarettes smoked per day for WPQC patients was 8.5 cigarettes per day in comparison to the year-end average of 7 cigarettes per day, showing an average reduction of 1.5 cigarettes per day for our WPQC patients. The next few slides, I would like to share some patient testimonials with you that highlight the complexities of this patient population and the importance of providing WPQC services to them. Our first patient, MD, is a 69-year-old African-American female who was referred to the Medication Management Clinic for type 2 diabetes. Upon referral, her baseline A1C was 11.6%. MD was already pretty familiar with using the insulin pen, as she'd been using the insulin pen for approximately 3 years already. This patient's A1C improved from 11.6% to 7.7% through insulin titration and dietary changes. After meeting with this patient for approximately 4 months, patient's A1C jumped from 7.7% to 11.7%, with blood sugars ranging between 400 to 500 milligrams per deciliter. Continual dose titration without any effect on blood glucose led me to inquire patient's insulin pen technique. Patient appropriately prepared her insulin pen as we had originally educated her, but I noticed as she was delivering the insulin, instead of pushing the button at the end of the insulin pen to deliver the insulin, she twisted the dosing dial back down to 0, basically indicating that she had not been delivering any insulin to herself at all this entire time. Since patient's insulin doses were titrated up pretty significantly over the course of 2 months, I was forced to start her insulin dose from scratch using weight-based dosing and titrating to effect. Patient was re-educated on appropriate insulin pen administration technique, including teach-back method, to verify proper understanding. Now, MD's most recent A1C is very close to her goal with an A1C of 7.2%. Our second patient, JG, is a 57-year-old African-American male who was referred to the Medication Management Clinic for type 2 diabetes, hypertension, and dyslipidemia. Patient is a poor historian and was on a large assortment of medications for his chronic conditions. As a means to gain a better understanding of his healthcare needs, I requested that the patient bring in all of his medication bottles to his appointment. As I was reviewing this patient's medication bottles, I noticed that the patient had been taking fenofibrate, gemfibrozol, and atorvastatin. According to the patient's medical record, gemfibrozol was discontinued and replaced with fenofibrate 3 months prior. The patient explained that his outside pharmacy continued to fill the gemfibrozol using their automated refill system, and he continued to take it because it was being filled by the pharmacy. Patient's primary care provider was never contacted to inquire about prescribing both the fenofibrate in addition to the gemfibrozol. Now, during this patient consultation, I explained the importance of using one pharmacy to prevent drug interactions and potential medication events in the future. Before the patient left clinic that day, I influenced him to have all of his medications transferred to the pharmacy within the clinic building. Patient has since enrolled in the Medication Sync program to allow for a more convenient pickup for his prescriptions, along with the bubble packing services that we're providing to help enhance medication compliance. Our final patient, MM, is a 53-year-old African-American male referred to the Medication Management Clinic for type 2 diabetes. MM's baseline A1C upon referral was 9.1%. Initial interactions with this patient demonstrated limited health literacy. After working with this patient for a few months, his A1C jumped from 9.1% to 10.6%, despite continual insulin dose titration to help reach therapeutic goal. During one of patient's appointments, it was determined that he was storing all of his insulin at room temperature, including his unused insulin pens. Due to inappropriate storage, his insulin lost its efficacy, causing the patient's blood sugar levels to rise despite continual dose titration. Not only did we have to provide education on appropriate storage requirements for patients' insulin, but we also redesigned his insulin regimen from scratch using weight-based dosing and titrating to goal. Now, MM's most recent A1C is currently within goal with an A1C of 6.9%. Now, we have a second situation which arose with this same patient, MM, involving running out of his test strips early and unable to pick up a new prescription for test strips because it was too early. It was determined during one of his appointments that he was skipping his mealtime insulin due to his inability to test his blood sugars before meals because he didn't have any test strips. So why exactly was MM running out of his test strips too early? During one of his appointments, it was identified through a glucometer download that the patient was testing his blood sugar every 1 to 2 minutes after a hypoglycemic reading until his blood glucose was above 100 milligrams per deciliter. Essentially, this patient was using 7 to 8 test strips every time he had a low blood glucose. It was determined during this appointment that the patient did not understand the concept of time and couldn't tell the difference between 1 minute, 5 minutes, or even 15 minutes. So the patient was running out of his test strips early due to an unnecessary overuse of test strips because he didn't know the difference between 1 minute and 15 minutes when he had hypoglycemic readings, causing him to skip his mealtime insulin due to not knowing how much insulin to take without actually testing his blood sugars. So extensive amount of time was spent with this patient providing education on basically how to tell time and the concept of time for him. As a conclusion, I would like to share a few opportunities that are utilized in the medication management clinic, which have helped to make WPQC more efficient within the clinic. Both student and resident involvement have really helped to bring new perspective and voice to this patient population and help promote clinic-based MTM interventions for our learners. Multidisciplinary team involvement. The team-based approach among the Family Care Center and internal medicine clinic providers and caregivers have really allowed for extensive collaboration of pharmacist-recommended interventions. Having a pharmacy within the clinic building has also allowed us to expand on services provided to enhance medication adherence through double packing and cost savings programs. And finally, the new hypertension clinic, which has opened within the internal medicine clinic, has allowed us to work with patients through providing hypertension-based comprehensive medication reviews. Within the hypertension clinic, we evaluate patients' medication lists, meet with patients to determine accuracy of the medication list, provide education on medication therapies, and then finally provide therapy recommendations. Thank you so much for allowing me to share how we integrate WPQC into the clinic workflow of the Medication Management Clinic at Aurora Sinai Medical Center. Please let me know if you do have any questions. Thank you.
This webinar is a portion of the Wisconsin Pharmacy Quality Collaborative 2018 annual meeting presentation entitled Serving the Underserved, celebrating 10 years of making a difference with WPQC. For this portion of the video, we'd like to show you how pharmacists are using WPQC as a platform to provide holistic care beyond the pharmacy. By incorporating programs to promote public health and population health, more pharmacists are able to impact the underserved than ever before. The Wisconsin Department of Health Services and Wisconsin Medicaid have teamed up with WPQC for the joint mission of providing comprehensive care to those in need. The Department of Health Services has provided us a video statement of congratulations on the WPQC 10-year milestone.
Hello, I'm Tom Ingalls, the Wisconsin Department of Health Services. DHS has a long, rich history of working with the Pharmacy Society of Wisconsin. We understand and appreciate the role that pharmacists play in helping Wisconsin Medicaid members receive the medications they need for healthy outcomes. We have worked with and supported the Wisconsin Pharmacy Quality Collaborative from the beginning. And in 2012, we implemented a medication therapy management program for Wisconsin Medicaid members. Before that, our senior care program was only a prescription drug benefit. Now, thanks to WPQC, Wisconsin seniors can receive a comprehensive medication review that helps them live their best lives. As of June, Wisconsin has paid over $3.5 million for comprehensive reviews. That includes over 128,000 prescription drug claims. We've heard from our members. They value this program, and we value you. We look forward to continue work with the Pharmacy Society of Wisconsin and the Wisconsin Pharmacy Quality Collaborative. Happy 10th anniversary, WPQC.
Today, you will hear how Southeast Asian refugees are being served at the Kashia House, a Journey Mental Health Center. Kashia House is located on the Mendota Mental Health Campus on the north side of Madison. They have an on-site psychiatrist, and coordinator Mai brings in pharmacist Stacy to provide comprehensive medication reviews to refugees through the help of a translator. In Boscobel, pharmacist Michelle Farrell is tackling public health in a rural setting. She has brought the Weight Watchers program to her pharmacy, where she is making a huge impact. Amazingly, this program has facilitated Michelle's deprescribing efforts. Almost too well. She often jokes that her Weight Watcher patients are putting her out of business.
The Chronic Disease Prevention Program, or the division, is very fortunate to have PSW because you're a really strong partner and you work so effectively and collaboratively. Through the work of WPQC in accrediting and certifying the pharmacists as well as the pharmacies, that we're going to get consistent MTM services across the state. What we have to do is get those patients referred to those services. And I think we recognize it here in Wisconsin, but nationally CDC recognizes that MTM services and the work of pharmacists really needs to be included, so that communication, the use of the EHR, and all of that work can be bidirectional, but also inclusive of the patient and their families.
Is another one of those offshoots of Journey. So it's a Journey mental health program. It's essentially a senior center for Southeast Asian refugee population. I guess I didn't ever realize how unique it was until people started asking. And the patient population is just really different.
Many of them experience, they have a lot of family member lost during the war, and due to language barrier, this is the only program that provides service to them.
Certain things that don't translate well into their culture and their and with the language. So, you know, depression. Are you depressed? Well, of course I had to leave my family in another country and half my family members died. And you know, so I mean, all those things of course are going to make you sad. But like the concept of actual depression, I think, isn't always really understood.
Oh, well, because we have a lot of clients who are very confused about their medication. They do have a children at home who speak the language, but the children are working.
More traditional medicine that they sometimes use. So they'll have bags of tea or herbs that people have brought them from traveling home. They don't know what's in it. I don't know what's in it. They can just, you know, they tell me what they think they're using it for, and how often they're using it, and we just kind of go from there.
It would be nice if Stacy can come in and try to work with clients to understand the medication, and then if they have a problem, communicate between themselves and the doctor, that Stacy can be the person that, you know, talk to the client's doctor.
And we became Weight Watchers leaders. We just really felt like it was a good opportunity for the pharmacy to really highlight the public health aspect of weight loss. Grant County, the county that we reside in, it has very, very high obesity rates. So it's just one of those things that goes along with medication management that seemed like a no-brainer.
It's really convenient for me because I live 5 blocks away. But once, and I decided that I should do this because I did gain weight because I sat around, didn't do anything, you know. I was just trying to live. So I thought this would be a good thing, and knowing Michelle and a couple of people that belong, I thought, well, let's give it a shot. many nights we have 25 or so people that stay for the meetings. That's a lot. So at the meeting, she'll say, put me out of business. I mean, and a number of people have gone off medications.
Hello, I'm Tom Ingalls, the Wisconsin Department of Health Services. DHS has a long, rich history of working with the Pharmacy Society of Wisconsin. We understand and appreciate the role that pharmacists play in helping Wisconsin Medicaid members receive the medications they need for healthy outcomes. We have worked with and supported the Wisconsin Pharmacy Quality Collaborative from the beginning. And in 2012, we implemented a medication therapy management program for Wisconsin Medicaid members. Before that, our senior care program was only a prescription drug benefit. Now, thanks to WPQC, Wisconsin seniors can receive a comprehensive medication review that helps them live their best lives. As of June, Wisconsin has paid over $3.5 million for comprehensive reviews. That includes over 128,000 prescription drug claims. We've heard from our members. They value this program, and we value you. We look forward to continue work with the Pharmacy Society of Wisconsin and the Wisconsin Pharmacy Quality Collaborative. Happy 10th anniversary, WPQC.
The next video features Dave Hager, Director of Pharmacy Clinical Services at UW Health, who describes the unique manner in which UW Health inpatient pharmacists are utilizing the Epic platform to send a discharge handoff summary from the inpatient pharmacist to the community or long-term care pharmacy where the patient will transition to once they leave the hospital. In a nutshell, at discharge, a standard report is communicated to the patient's community pharmacy. The report includes standard items listed on the screen. In the video, you will hear how the UW Health vision that began several years ago has grown, and how they partnered with 6 WPQC pharmacies this past year to evaluate the process.
So transitions of care has been a focus at UW Health for quite some time. We think it's important that when patients both enter and leave our organization, that it's done in the most safe and effective way. And we've had pharmacists really involved in the transitions of care process since the early 1970s. One of the things that we had identified as a potential gap is that really the first place that patients go when they leave our organization is to their community pharmacies. And that's another person who can help extend our care into the community and help assist our patients and help them keep them out of our hospitals and keep them at home. That one of the limitations that community pharmacists face is that they don't even know that their patients have left the hospital. They don't have easy ways of identifying where these prescriptions came from and how they're different. And a patient leaving the hospital probably has different needs.
I remember the days when a patient would walk in after being discharged, or many times it was a family member, to pick up a prescription. They didn't know what the patient had been on. We didn't know what the patient had been on. Invariably, the patient would ask, when do I take my next dose? And we had no idea if they had a dose before they left the hospital or if they needed one as soon as they got home. So in that respect, having that information at our fingertips has been great.
Just keeping everyone on the same page. We know before the patient is even in to pick up their new prescriptions from their stay inpatient if anything has changed or been discontinued, what decisions were made inpatient can kind of influence how we practice here in the outpatient setting, and just keeping everyone on the same page has been beneficial. I have one patient that's been in and out of the hospital several times, and his wife is the caregiver, and she just is amazed that we know everything that happened during his stay and can use that to benefit his care.
Well, I just think we're so much more well-informed, so I think you can have some conversations that you probably wouldn't have been able to before. And you know, people come in from the hospital and you can ask them those questions like, what was it, you know, is this a change or whatever, and a lot of them aren't in the right space to answer those questions. So if you have them, then you can just reinforce the changes, or you can talk about follow-ups, and so it's just another person as they're transitioning to give them support. So.
I think the program really is designed to do something that I think we're very familiar with in healthcare, which is if I were a primary care physician or a hospitalist in my health system, as a pharmacist or as a physician, I would be asked to write a discharge summary and make sure that that primary care physician that's going to take over the care of my patient knows what happened to them on the inpatient side. And I think we as inpatient pharmacists, kind of broadly, should have similar expectations and responsibilities to making sure our partners, our primary care providers, our community pharmacists have that same level of data. What we've found is out of 103 patients that have been entered into this study, just out of these 6 partner pharmacies, they've identified almost 333 discrepancies because of sending that list. Now, many of those are intentional. I'm telling the patient and communicating to the community pharmacy that, yeah, we are starting this new medication because they had an MI. But what we also found is a large number of unintentional discrepancies, which are really things that probably through the process of us obtaining the list when the patient comes into the hospital, the changes we made or sending them out, there were things that did not match between what we thought the patient should be taking and what a community pharmacy has on file. And those are really the ones that we want to resolve because those are the types of information that we're going to improve.
This webinar is a portion of the Wisconsin Pharmacy Quality Collaborative 2018 annual meeting presentation entitled Serving the Underserved, Celebrating 10 Years of Making a Difference with WPQC. In this video, you will see how WPQC pharmacists are committed to providing continuous and holistic care to their patients. Through comprehensive medication reviews and regular follow-up, these pharmacists are making a big difference in the lives of many. One shining example of continuous care is the collaboration between WPQC and the United Way of Dane County. Over the past 7 years, United Way has taken a 3-pronged approach to reducing adverse drug events and falls for the older adults in Dane County. One of those approaches is through collaboration with WPQC to bring comprehensive medication reviews to senior centers and other access points across the county. Instrumental to this collaboration are Helene McDowell and Toya Johnson, pictured with our own Carrie Trapskin. Through their work with many senior center coordinators, they have scheduled 30-plus WPQC certified pharmacists to conduct over 1,200 medication reviews for patients. Following these medication checkups as the PSW interns, Colin Pearson and I facilitate the follow-ups by contacting patients over the course of 3 months and then connecting them back to the pharmacist as needed. See for yourself how we are closing the loop on patient care.
The 2 elements that we are focusing on in the Self-Reliance and Independence program right now is to reduce adverse drug events and falls for older adults. When we decided to do this, we reached out to the Pharmacy Society of Wisconsin to be our partner, our primary partner, to do this work. So what a unique element of this partnership with the Pharmacy Society of Wisconsin is that it's really a global initiative that we're working to get out into the community and serve families that may not necessarily be served at their pharmacies. The community-based events are really very comprehensive and look at the whole picture. Sometimes the spouse comes with them to a medication review, so it's an opportunity one-on-one for approximately an hour for that pharmacist to talk to the older adult and the spouse/caregiver to really help them understand their medicine.
multiple CMR events at the senior center here in Aurora. And it's very nice because I do have a lot of the patients that come to those CMR events are also customers of ours here. So it just gives me a little extra time to be a little bit more in depth with their medication profiles and things that are going on that they might not talk to me about in the store setting. It's rewarding, and it's the customers that come here that I've helped in the CMR and they come back and say, oh, that was such a great recommendation, or I've been doing this and it's made such a difference. That's the rewarding part of it.
Well, I guess making sure the patient is qualified for a CMRA, getting a PA for a WPQC service, doing some intake, and then doing the billing at the back end as well. So I've been able to do all aspects of that, and it's nice to see something start and finish and kind of know where that process is going. And I think that's, to me, what WPQC means, is making sure the patient is getting all aspects of care no matter what they need. If they're coming in for a pair of crutches or if they're coming in for a blood pressure medication, that we can kind of get them from all angles. So I think the program is great, and I wish more pharmacies used it. You hear a lot, well, I don't have time for that. And I think my main piece of advice is find time.
And every pharmacist I had has suggested something or other, dietary or whatever, and they follow up and send you stuff in the mail, and that's very nice too.
Say, you know, another nice advantage to this program is now I kind of feel like I have like a personalized pharmacy program for myself, because, you know, I got to know her, and now, you know, I've never really known my pharmacist before. I just come in and pick up my meds and that's it. So now I know that I feel very comfortable that I can call her and ask her questions, or that she'll follow up on things if I'm concerned about something. So I like the fact that I wasn't rushed, and I felt like she really wanted to get to know me and was really concerned about me. That I think is the most important thing. That was the most important thing for me. And it wasn't just about the meds. You know, it was about my whole health lifestyle, I guess you would say.
Hello? Good afternoon, Susan. This is Colin with the Pharmacy Society of Wisconsin. Just following up with you from your United Way visit. Is now a good time to talk?
Yeah. Will it take long?
Oh, no, it shouldn't be more than 5 minutes. So after patients meet with pharmacists during their comprehensive medication review, Emily and I have a responsibility to make follow-up phone calls with these patients. During the follow-up phone calls, which span several months, we address patient questions and concerns, and we see if patients have had any falls or hospitalizations. Another aspect of the phone call is to address any of the suggestions that the pharmacists have made to the patients, and see if the patients have incorporated them into their lifestyle.
So by Monday, you can call back and I should have all the information I need for you.
Okay, that sounds great. I will plan on calling you back on Monday. Thanks so much, Timothy.
Thank you, Miss Emily. Have a good one.
You too. Bye now.
We hope that this video montage has provided a sense of the humanistic work that is ongoing throughout the state in not only WPQC pharmacies, but also primary care practices. We joke at the PSW office that our summer interns can't get through the summer without being asked to create a video for a portion of the annual meeting. This summer was no exception. Colin, Emily, and Kinsey exemplified the definition of teamwork and truly made this presentation a reality. They worked well together, as well as with Megan Grant, the magic behind all of PSW's design work, including this video. And of course, the subjects of our videos. To the WPQC pharmacists who coordinated patients, caregivers, and physicians to participate, we genuinely thank you for working with us to spotlight only some of the great work that WPQC pharmacies have been involved in to serve those who need it most in Wisconsin. What we have shown you today reveals only the tip of the iceberg of what WPQC pharmacies are involved in, as well as the number of opportunities for expansion across the state. If you have been inspired to become more involved in WPQC, regardless of whether you are currently certified and work in the community, primary care, or inpatient settings, PSW is happy to help connect you with other practices similar to yours, assist you in enrolling in our remote conference call-based coaching work groups, or provide answers to your specific questions. Won't you join us in the movement to help us to meet our goal of serving 10,000 Medicaid members by the end of this year? Thank you.